questions. When this ministry has a lot of contempt for the Committee of Health of the Senate. That is it. But it is okay. If that one question is sufficient, we shall sit down. Thank you.
You know you have that under very sensitive matter when the CS is here. What did you say? What is it you want this house to help you to do?
Honorable Speaker.
Because you are the one I'm tasking to follow up these KEMSA issues. And then you are still again.
Yes, but we are also telling you as it is. Honorable Speaker, sorry, Honorable Speaker, allow me to say this. Health is about 90% involved. But the involvement of the ministry in the Committee of Health of the Senate is 10% of the involvement. They have a preferential treatment of working with National Assembly as opposed to working with the Senate. Honorable Speaker, you are aware we had our midterm review of the Senate activities for the last session. We have only 2 years as a committee to help this government to make sure that UHC is properly rolled out, benefits Kenyans. Did you see any of the Ministry of Health officials in Naivasha when we had our review as a whole Senate, not as a Committee of Health? So, Honorable Speaker, when we say as a committee we are frustrated, the majority leader knows. I had even asked him to stay away from chairing the Senate Health Committee because I don't want to be associated with failing. When we have a whole committee that is willing, they are committed, they have innovative ideas. You have heard what Senator Ledama said. And we are willing to make our contribution and our ideas and innovation on how we can make these things work. Honorable Speaker, you know I'm a governor emeritus. I've also run health for 10 years. The ministry can benefit from my experience as a governor on how we can handle issues of pending bills in the county. But where is the opportunity to have this discussion?
Senator Mandago, those are very valid concerns. And as a chair, it's really not, it does not sit very well when the CSU are here and the chairman of health is complaining that he's not able. And the whole team, you can understand and appreciate the ideas coming from the Senate. Yeah? And our concern is really on devolution to work. And that is our core constitutional mandate. So if the chairman of health is here complaining, lamenting that between you and them there is a disconnect, and you see from the chair I'm giving guidance on what should be done on KEMSA, the reports and all these things. Does it mean also the directives that I'm giving will not be implemented? So I think give your commitment that you will really work with the Committee of Health of the Senate. Give that commitment while you are here today.
Yes, Honorable Speaker and honorable members, we want to inform you we acknowledge and we really send our apologies for that. For the 3 that we have been summoned, we've been able to go for 2 meetings, which were quite fruitful, and we were able to pick some very critical concerns that we addressed and some very innovative ideas that we were able to implement. And so we really, really, as I said earlier on, appreciate the work of the Senate, and we want to really collaborate together to ensure that Taifa Care becomes a success. So out of the 3 we attended to, we missed 1. That was because of our cabinet meeting, and I shared I shared the same with the Senator Mandago. But moving forward, we want to assure you that we'll be working collaboratively. Indeed, health is devolved, and these are critical things that we need to look into to ensure that we have successful implementation of Taifa Care. So we apologize, and we assure you that you will not see another incident like this.
On the midterm review of the Senate work, you went there afternoon scheduled for you during that retreat, and still you have not presented your paper to us. Maybe you must get your time to engage the Senate. You come on a free Kamkunji and engage the Senate, either through here or any other place, so that also you can present your issues, and also senators will be able now to interact with you and also help your ministry to serve Kenyans better, especially to make sure that our hospitals in the counties get the necessary attention that they need. So another commitment, find your time through the majority leader is here, through the clerk of the Senate, so that you can also get your time to present the issues that you are to present in Naivasha 2 weeks ago. Let's go to the next question. Senators will get an opportunity still now to interact with your question. All these health issues are just the same. If you listen to the Senator Wambua's question or questions, they are interrelated with the issues that you are raising on this floor. Therefore, so, Senator Manzo, what did you say initially?
In one sentence. So, Mr. Speaker, I was just simply asking, if Senator Oladamba gets a seizure and I'm seated next to him, what will I do? And this for benefit of you and the rest of the community, as a medical doctor. I mean, a lot of people get seizures, people run away from them.
When I was in school, we used to have, you can put a spoon so that it doesn't cut the tongue. But the CS, you can advise Senator Manzo what to do when he gets somebody with a seizure. What should he do?
Thank you. So we have our ABCs of resuscitation. We have guidelines and curriculum for first aid management, again for resuscitation of cases. And again, we have various bodies that support in training on the same. And so as a ministry, we have placed the curriculum and guidelines for first aid, including management of seizures. And I believe that moving forward, we'll be able to strengthen that and improve our monitoring and evaluation to ensure that all Kenyans are informed on how to conduct first aid for patients with seizures.
Senator Manzo, when those sensitization dates are given, you must avail yourself for that training. So let's go to the second question by Senator for Kitui County, Enoch Wambua. Senators, you know, it is where I sit, there are so many things we do, consultations, Senator Amina Kibwana. I know you have a question and you'll be able to ask. No problem.
I thank you, Mr. Speaker. Mr. Speaker, I see my brother, Senator Wakoli, in a deep conversation with the CS, which is a good thing. I'm sure he is briefing out on a few things. Mr. Speaker, I will ask question number 10. But Mr. Speaker, before I do that, because my gadget was on for a long time, to raise an issue or two on previous questions. I will raise them, and the CS does not need to respond. I will just raise them, and I will continue with my question. The Speaker, one of the issues that I wanted to raise was the issue that was raised by Senator Olekina. Clearly, Mr. Speaker, we have a problem. And you know, Mr. Speaker, one of my biggest weaknesses is to say things as they are. We have a big problem. One of the biggest problems that we have is when people want to answer their own questions. You know, I ask a question, but you want to answer your own question. The Speaker, the Dama asked a very leading question that would really have helped us as a country in terms of management of healthcare.
Senator Ombo, gave very clear guidance on the matter.
Mr. Speaker, please hear us out, Mr. Speaker. Just listen to senators. Mr. Speaker, this is a house of debate. If you want to put us in a straitjacket, we will not fit there.
This is now not a debate time. Of course, you know, you have a question that we're supposed to answer.
Yes, Mr. Speaker, and I say that I had raised a point
and
that
I placed that matter on the committee on health. Why should we go back to
I don't sit in that committee, Mr. Speaker. Just allow me, if you will. Mr. Speaker, there are different ways of managing healthcare, not just in Kenya, but across the country, across the globe. You could lease equipment you could do direct procurement, you could do managed equipment scheme, and Senator Ledama brought up a very important issue of placement. And that's where we get help, Mr. Speaker. Where manufacturers could actually place medication in hospitals and the drugs are released to patients on prescription and paid for upon use. So that when the drugs are expiring, the manufacturers bear the responsibility of withdrawing their own drugs and the hospitals do not suffer over expiry. Mr. Speaker, I'll go to my question because I see a level of impatience on your part on this matter. Mr. Speaker, I want to ask the Cabinet Secretary for Health. Question number one. How much money in terms of contributions was in the accounts of the National Health Insurance Fund at the time of transition to the Social Health Insurance Fund, SHIF, and could the Cabinet Secretary state the banks and bank accounts in which the money was held? Question number two, has the money been fully transferred to the Social Health Authority accounts? And if so, could the Cabinet Secretary state the banks and bank accounts into which this money has now been deposited? Question number three, how much money has been collected from contributors since the advent of SHIF? And could the Cabinet Secretary state how much has been utilized for the benefit of contributors, their beneficiaries,